Are there natural treatments for diabetes? That's the question we're talking about today on Ask a Doc. I'm Dr. Michael Smith, a naturopathic physician who loves helping people with chronic disease. Now, what is chronic disease? It's anything that lasts longer than 2 weeks, 2 months, depending on the definition where you get your source and information from. But it's anything that lasts a long time. Like a cold lasts like a short time. Diabetes is a long thing. It takes a long time to get to that point where blood sugar levels are high. And it takes a long time to treat. It's a chronic disease, and I think that naturopathic medicine is so well suited to treat patients that have chronic diseases like diabetes. So, to answer the question, are there natural treatments for diabetes? Absolutely yes. That is a certainty. I think there are so many things that can be done to help patients who have diabetes. I was recently having a booth for my clinic at a local fair, and I had the opportunity to talk to a lot of people about lots of different things. And the thing that kept coming up quite a bit was diabetes. People coming saying, I'm taking this like handful of pills every day. I don't like it. I don't want to have to take this many pills for all of my medical conditions. And I think if we ask the general public, what the treatments are for diabetes, I think there's two things, that's my guess, two things that we would get as answers. Number one, being diet. You got to watch your diet. Cut your sugars, cut your carbs, things like that. And we'll talk about that more. Number two is meds. Metformin, glipizide, insulin. There's so many meds treating different pathways and aspects of diabetes to help lower blood sugar. And you might ask, why are you talking about meds? Because I think meds do have their place. If blood sugar is super high, sometimes we might just need to give insulin. We might need to take metformin. That might have a place. But it's not where I like to start when treating. I really like this diagram from the American Association of Naturopathic Medical Colleges. So it represents all of the naturopathic medical schools, including the one that I attended, the National University of Natural Medicine in Portland, Oregon. This is based off of the work by one of my former professors, Dr. Jared Zeff, and other people, summarizing how doctors, naturopathic physicians, approach treatments generally. Now, I went through this in my Ask a Doc video about headaches and migraines. So I invite you to go check that out, where I walk through it a lot. But in essence, where I like to start, if I can, with patients, is the bottom, establishing the foundations of optimal health. If we need to, we can restore weakened systems in the body. We can suppress symptoms. We can address with drugs. Drugs fit up here in this part of the naturopathic therapeutic order pyramid. They do have a place, but it's at the top. And I try to work up, not down. I try to start with the bottom where I can. Sometimes I start at lots of levels on it, actually. But I start at the bottom when I can. And there are so many options available. I really think that the naturopathic treatment for diabetes is a great opportunity to talk about the 6 principles of naturopathic medicine. You may not have heard of them before. That's fine, because I want to share them with you. The first of these principles that's been adopted by the naturopathic profession in the United States and Canada. I'll have a link to that website down below. The first principle is the vis medicatrix naturae, Now, you may not have taken Latin in school. That's fine. You may have recognized nature, the naturae, medicatrix, the vis. What do those mean? It's effectively encompassing the idea of the healing power of nature. We have nature inside of us. We've got nature outside of us. And the nature inside of us needs the nature outside of us. I truly believe that. I truly also believe that our bodies have an intrinsic ability to heal themselves. When we get a cut, it gets fixed. When we break our bone, the bones can mend. Our cells divide, they replicate, they regenerate. Our immune system fights off infection. Our bodies are amazing. They can heal themselves. That's the nature part of it. And while there are many things some things that might be more challenging to fix, I truly believe that is always something that we can do from a naturopathic medical standpoint to improve the quality of life of patients and those they love, that love them, their families, their friends. That's the vis. When I'm treating somebody with diabetes, I'm wanting to support their body's ability to heal itself, first and foremost. We need to remove obstacles to do that. Diet, I think, could be one of those obstacles. If we're continually consuming a lot of sugar, keeping our blood sugar high, it's going to be difficult for our body to heal itself. As a naturopathic physician, my trainings included nutrition. We talked a lot about using nutrition and food as medicine. And that's often where I start. I help patients where they're at with the things that they can control and work with them little by little to make change. It's not going to happen overnight. Didn't get there overnight. It's not going to be solved overnight. So we're going to work little by little to change, to stimulate the body's ability to heal itself and to become healthier and feel better. The second principle of naturopathic medicine that I want to talk about is, above all, to do no harm. It doesn't mean we're not going to do things like minor surgery or something like that might hurt a little bit. But I think when possibly try to minimize the harm, the side effects from the treatments that we prioritize. That's why the medications are at the top. That's where I go to kind of at the end. If things aren't working, then we'll go to drugs. Generally. Not all the time. But as a naturopathic physician, I want to help minimize the effect of the side effects that drugs have. There's also natural products also have side effects, so we need to be careful with those too. But we try to minimize the effect that drugs, including the handful of drugs that people say they're taking that they don't like taking, that have on their body. That's what I like to try to do. The third principle that I want to talk about is docere, or the idea of doctor as teacher. I love teaching patients. I love explaining what's going on with them inside, what's happening inside their body. And as I teach them, they're able to better understand the principles of why things are maybe not going on the way that they should. I believe that behavior is best changed when somebody understands the why, the principles, the why things are going wrong or going right in some cases, the opposite. I was recently reminded of the work of Simon Sinek, who talks about the knowing your why, the power of why. If you know your why, you're going to make changes to accomplish your why. If you know why your body is not accepting sugar, the way that it should, regulating your blood sugar levels, you're going to change your habits in to align with that why. If you have a desire, a deep purpose, deep desire to change your life, you're going to stick to that because that's part of your why. That becomes your why. You have something to live for. And as a naturopathic physician, I absolutely love supporting patients, being a coach, being a cheerleader, being a guide, being a mentor, being a partner with them, working with the patient to support them in their healing journey. It's a journey. There's going to be ups and downs. There's bumps in the roads. There's forks. Knowing which fork to take, knowing where to turn, knowing how to adapt when needed. That's what I am trained at. That's what I'm good at. And it can help patients with. There's other principles. There's 3 others that I'm going to kind of clump together in some ways. Number 1, the fourth one is treating the root cause. Really understanding what is going on with a disease condition. Is it the pancreas that's causing insulin dysregulation? Or is it maybe related to polycystic ovarian syndrome or PCOS? Where the ovaries are causing some insulin dysregulation? Is it the heart that's involved? Is it the liver that's primarily the target here? What is exactly going on in the body that's leading to this diabetes picture? Related to that, as a physician, I'm treating the whole person. That's the 5th principle, by the way. Treating the whole person. If somebody has diabetes, that means their insulin, their blood sugar, their pancreas that creates insulin, all these things are kind of out of whack. But they all affect so many parts of the body. They affect the feet with diabetic ulcers, perhaps, diabetic neuropathy. They can affect the brain with blood sugar dysregulation. It can affect the liver, the kidneys, the heart. Diabetes and heart disease go well together. Diabetes being a risk factor for heart disease and vice versa. So when I'm treating diabetes, I'm not just treating sugar. I'm treating the whole body. We're making sure that everything is operating at maximal capacity as possible to make sure that blood is going where sugar is going where it needs to, and try to minimize the effect that high blood sugar has on the body. Related to that is the 6th principle of prevention. We want to prevent diabetes from getting worse. We want to prevent the effects that diabetes has on the heart, the effect that diabetes has on the liver, that diabetes has an effect on skin or brain or whatever other body system we're looking at. We want to prevent that. For somebody that might already have diabetes, we might not be able to prevent diabetes from starting in the first place. That would be primary prevention. We can prevent it from getting worse, from affecting other things. That would be like secondary prevention. Things can always improve. We can always change. I think there's so many things that we can use in the big, huge toolbox of naturopathic medicine we can draw from to help support people with diabetes. These include diet. We've talked about that. Helping someone optimize their diet to minimize their sugar intake, for example, carbohydrate intake, to balance their blood sugar with protein or other vegetables, things like that. And using simply that. Maybe it's not even the food that we're eating, but the order that we're eating it in. This is an idea that comes from Jessie. I'm not going to try to pronounce her last name because it's French, and I'm still working on my French. She is known on social media as the Glucose Goddess. So I'm going to put the link to her profile down below. Her diagrams are amazing in showing the effect that certain foods have on certain on our blood sugar levels. And not only what foods we eat, but the order that we eat them in. By prioritizing vegetables first, then the meat, then the protein, and then carbohydrates last. That's effectively the same order that we eat our food if we go to a really fancy restaurant. You start with your salad, your appetizer maybe, you go to your main course, your meat, your more vegetables, maybe a few starches, but then at the end is your dessert. That's the end. Because if we prepare our stomachs and our bodies with all these other things first, then when we have that nice palate cleanser of a dessert, it's not going to affect our blood sugar as much because of the order that we eat our food in. Things like that. What we eat, when we eat it, how we eat it, with whom we eat. I gave a whole presentation on the science of eating. I'll link to that in the description as well. Feel free to check that out because I talk about all of those things, eating more mindfully. Exercise and movement is huge for keeping the heart healthy, the body moving, blood flowing, sugar moving throughout the body so it doesn't just stay in one place, but it's dispersed. Our muscles are using it. They're going for a walk after eating, for example, can be great for that. Things like intermittent fasting, hydrotherapy, using healing properties of water. Think cold plunge. Think sauna. That's hydrotherapy. Using a fancy word, it changes the metabolism of our body, our metabolic rates, so many other things, simply controlled by water and of different temperatures. It's pretty cool. There's also lots of herbs and plants that we can use to either regulate our blood sugar, help keep it low, support our body's systems and ability to heal itself. These herbs and plants include gymnema, edible foods like garlic, onions, cinnamon, blueberries, fenugreek, ginseng, mulberry, things like that. There's so many plants in nature. We talked about nature inside of us, needing nature outside of us. By bringing the nature outside of us inside of us, it can exert wonderful healing influences. There are supplements that we can use that combine a lot of those plants, vitamins, nutrients that our bodies need. There's so many things that we can do to support our body, especially with blood sugar issues, naturally. That's what I love doing. That's why I'm here. And that's my answer to the question, are there natural treatments for diabetes? The answer is a resounding yes. Of course, each treatment is going to be adapted to the individual. What the diabetes treatment plan I give to one person is not going to be the same that I give to another person. There might be some overlapping elements, but they're not going to be the same. That's on purpose, because each one of us are different. And as I'm able to help so many different people thrive, it's rewarding to be able to see their lives change. They understand their why. They understand what they're able to do, how they're able to do it, and keep moving forward, living their best life in the best way possible. If you found this helpful, like the video, subscribe to my channel, and I look forward to hearing from you, your questions. What do you want to ask a doctor of naturopathic medicine? What's been on your mind? What's curious to you? I'll love to answer those questions in an upcoming video. So until next time, I wish you all the best and be well.